What is progressive overload for post-op lifting? If you have recently had surgery and are eager to regain your strength, you might be wondering how to safely lift weights again. One key concept to understand is progressive overload. This approach is all about gradually increasing the weight or resistance you use during your rehabilitation. The goal is to rebuild strength without risking injury or slowing down your healing process. After surgery, your muscles, tendons, and joints need time to recover. Progressive overload helps by challenging them just enough to promote adaptation and strengthening. However, this must be done carefully and tailored to your specific healing state and type of surgery. You will typically start with very light weights or resistance. Focus on exercises that improve your range of motion and mobility before you begin adding more weight. For instance, after a shoulder replacement, you might begin with light weights or resistance bands. A good rule of thumb is to increase the weight by no more than 10 to 15% every 10 to 14 days. Always keep an eye out for any pain or discomfort, as these can be signs that you are pushing too hard. Here are some important tips for progressive overload in post-operative lifting. Start with light weights and prioritize your form. It is essential to avoid stressing your healing tissues. Focus on using the correct technique and controlled movements. Increase the weight slowly. Generally, aim for small increments, like 10 to 15% every week or two, depending on how your body is responding. Pay attention to your body. If you notice any pain, swelling, or unusual discomfort, it is wise to reduce the intensity or pause your progression. Rest is vital. Make sure to allow adequate recovery time between sessions to let your tissues heal and adapt. Always follow your medical team's guidance. Your surgeon and physical therapist will provide specific recommendations based on your surgery and individual needs. Avoid heavy lifting until you receive medical clearance. This often takes 3 to 6 months, depending on how well your body has healed. Incorporate warm-up and stretching into your routine. Proper warm-ups before lifting and stretching afterward can help maintain joint health and prevent injuries. To give you an idea of what a post-operative lifting program might look like, consider this timeline. In the initial phase, which lasts about 6 weeks, focus on gentle range of motion exercises and light isometric movements without added weight. Avoid lifting anything heavier than 5 pounds during this time. During the strengthening phase, which typically spans weeks 6 to 12, you can start light strengthening exercises with low resistance. Gradually increase the load as your body allows. Once you reach the progressive overload phase, which is usually after 12 weeks, begin to slowly increase the weight. Ensure you do not experience pain or setbacks during this time. Finally, after 3 to 6 months, or once you receive medical clearance, you can return to heavier lifting. This should be guided by individualized protocols that consider your goals and surgical outcomes. Progressive overload for post-operative lifting is about safely rebuilding strength through a controlled and gradual approach. It requires patience, careful attention to your body's signals, and collaboration with your healthcare providers to support a smooth recovery.